So here's how we want to do the therapeutic exercises. Put it around the doorknob like that. You stand back. In the first series, you make sure I put a little X right here on the door, and you just keep your eyes on that so you're not shifting your head down and rotating it too much. So the first one, you stand and you want to do what's called a pelvic tilt, where you keep your back straight and you kind of move your hips forward and you stand here, arms extended, and this is the first one. And you want to do about 20. That's 4, that's 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. That's really good. Take a little bit of a break, make sure you're breathing good, and make sure your posture is really good and keeping your stomach tight. Well, the second one is that you want to just pull down. All right? You do just these exercises. Okay? And you're going to do about 20 of these. That's 5. That's about 20. Okay, the next one we call an infraspinatus. You're going to stand here with one hand on your hip, this hand here, and you just rotate out as far as you can go. You just want to do that slowly like that. All right? You want to try to do again about 20 of those, but again, starting out only about 5. Okay? Like that. Now, the important thing on this one is that you should want to keep that elbow right here and do not raise that shoulder up and do not pick the elbow out. You want to keep it down and just do those rotations. And then you turn around backwards and you do the same thing with the other arm. Okay? Try to keep your head straight. I was looking at the camera, messing up, but you just go ahead and look straight ahead. And then you want to stand back again and you want to swing out like this. And you want to do about 20 of those exercises. Build up to about 20 of them. Alright, take another little bit of a break. After you've done your 20, I only did a few that time. Then you're going to do curls. But if you'll notice, when you're doing all these exercises that I'm showing you, it's actually putting a lot of helping you brace yourself from falling forward. So it's actually keeping your body, it's helping build your core strength. So again, you want to keep that pelvic tilt, you want to keep your stomach tight, you want to keep a wide stance at your base so you're good and balanced, and you just want to do about 20 of these exercises. Alright? We'll count that as 20. Alright, next one. You want to turn around like this. We're going to do just some chest presses. Alright? So you just push out like this. So it's really simple. You can get almost a whole body workout just by doing these therapeutic exercises at home, in the privacy of your home. And then we're going to work on your deltoids, which are your shoulders here. You're going to hold it to your sides and just lift them out. And again, you noticed you're having to brace yourself from falling backwards, so that's actually helping your core body strength as well. Right. Then we're going to do some triceps. So you do it like this. Now this one actually is a little easier if you just put a chair down and do it, so the rubber tubings are not rubbing your shoulders. So you can move a chair over and sit down, just have one that doesn't have any arms on it. The main thing about that exercise, you want to keep the elbows straight, see, and you're not rocking down with it. And that'll working on the loose muscles that are right here as you lose weight. Yeah. All right, then we're going to do some flies, which is like this. And there's really 3 pectoral muscles. So if you want to work on all 3 of you, do one right here, then one about right there, and then one a little bit higher. I want to caution you, and you just kind of go between 3. If you got a little bit of a shoulder problem or rotator cuff problem, at first you may need to just stay down here, okay? Because it's a little easier to do and it doesn't rub that shoulder joint. Let me just show you that with this skeleton I've got here. If you can see this, there's a joint right here where the shoulder rubs, and if you raise that shoulder up too much, these 2 joints, these 2 bones rub against each other, and after a period of time it frays it, and that gives you what we call a rotator cuff. But if you do your exercises down low, when you're rotating out like this, you're keeping those separate. and it's a little safer to do. So if you've got a shoulder problem, you want to avoid getting those shoulders up too far at first and making sure you don't have too much shoulder pain after you do these exercises. Put that back. So go back to these exercises. So now you've got several of them you're doing. You've got about 10 of them. Now in advanced strategies, you can stand here when you get in better shape and things are not hurting as bad and you want to do some extra ones. You can take both of them together and work like a tennis forehand swing. And that gives you a little bit more resistance, and you can do the other side like that. And that again helps the core strength, because you got to get your wide strength, core strength. Now this is more of an advance, so don't start these. And you can do the same thing with your shoulders. You can do a backhand. You can work on that shoulder just a little bit more, doing this rubber tubing exercise. And again, you can do it with this side. Okay. And if you want to work on the triceps a little bit more, you can sit down or get down lower and use both of them and do it like this. And that gives you a little bit more resistance. But again, when you're using both bands in one hand, that's more of an advanced strategy. It puts a little bit more stress on your body, and you want to save that after you've been doing these exercises for a while, or if you're in pretty good shape. This is a good warm-up. If you're really a bodybuilder, it's a good warm-up to do before you go work out with weights. But it's an excellent way to kind of keep your body in shape while you're if you got arthritis, and it's not putting a lot of pressure on the joints, because most of the injuries of joints happen when you first pick up a weight, and the resistance of rubber tubing bands, it doesn't start until after you had some resistance, so that the likelihood of an injury to a joint is much less. So I hope you can incorporate these into your life, these exercises, and remember, good health to you, and remember, like I've always said, make food your medicine, and try to avoid all those high fructose corn syrup products. Thank you very much.